Welcome,
Hello and
everyone.
welcome, everyone. Go ahead, Bruna. Sorry.
No, I was just gonna say we are waiting a couple minutes for everyone to join, and then we'll start with the Zoom instructions. But while we wait, you can already start introducing yourself in the chat. Well, I'll get started with the Zoom instructions. So as I said, feel free to introduce yourself and share comments during the webinar in the chat. You can do that by clicking in the chat and writing your comment or question. If you have questions, you can also use the Q&A function at the bottom of your screen. You'll see an icon that says Q&A. You can click there and drop your questions there. We'll address them by writing or maybe in the end by speaking. Thank you so much and enjoy the webinar. Over to you, Ivo.
Thank you very much, Bruna. Welcome, everyone. We're very excited to have this ICM Showcase webinar today with you, titled Climate, Crisis, and Care, and How Midwives are Driving this Response. Today, our agenda includes setting the scene and case for 1 more million midwives, why midwives are central to the climate response. This session will explore climate shocks, how climate shocks are intensifying humanitarian and health crisis with disproportionate impact on maternal and newborn health. It will highlight why midwives are central to the climate response, drawing on global evidence and frontline experiences to showcase their trusted, cost-effective, and adaptable role in strengthening resilient health systems. This will then be followed by a panel discussion, Voices from the Field, Midwives Leading in Crisis. The discussion brings midwives from diverse regions to share frontline experiences of leading care in crisis settings. We will then screen a short film that looks at the life of a midwife during a Pakistan's flood titled the Neha Film. And finally, we will then discuss Bridging the Gap, Advancing Climate, SRMNH, and Midwives Through Action. The session will examine where climate, sexual and reproductive maternal and newborn health, and midwifery intersect in global landscape and highlight the unique role of ICM as a convener, advocate, and enabler. I'm very happy to present the speakers of today's webinar. Anna of Agos joined ICM in 2025 as a chief executive. And as a chief executive of ICM, she's responsible for leading ICM and ensuring that the organization sets and achieves its strategic priorities. She works closely with the ICM president, the board, and the head office leadership team. Anna brings over 30 years of experience as a midwife and an educator, beginning her career at Karolinska Hospital in Stockholm and progressing through clinical, leadership, and supervisory roles in Sweden. Since 2010, She has worked internationally with UNFPA Bangladesh and Lao PDR, WHO, and Lardil Global Health and Lardil Medical, focusing on midwifery programs, partnerships, and simulation-based education to improve maternal and newborn health worldwide. Anna holds a bachelor's degree in midwifery and a master's in social science with specialization in nursing education from Stockholm University. Our second speaker is Solomon Helmeske Besha, who joined ICM this year as a midwife advisor, where he supports global strategies to strengthen midwifery education, regulation, and practice in collaboration with our associations and partners. He brings over 15 years of experience across clinical practice, education, leadership, and research, and contribution to global guidance through WHO. Solomon holds a PhD in midwifery and women's health from University of Gondar. He previously served as vice president and president of Ethiopian Midwives Association, where he led the first humanitarian response, deploying over 100 midwives to deliver SRMNH services in conflict-affected and displaced communities across 4 regions in Ethiopia. Steph Merritt joined ICM in 2024 as our midwife advisor, where she supports ICM and its member association, and is a member of the Humanitarian and Climate Task Force. Her background includes working as a clinical midwife in the UK with the focus on continuity of midwife models of care and safeguarding. Steph later became a midwife educator in the UK before moving into global health, working in a variety of advisory and coordination roles across Asia and Africa to support midwives in delivering safe, rights-based care in humanitarian and fragile settings. She holds a master's in public health from Liverpool School of Tropical Medicine. Neha Mankani joined ICM in 2023 as ICM's Humanitarian Engagement and Climate Advisor, providing technical support to humanitarian response and climate action. A midwife based in Pakistan, she has extensive experience in maternal and newborn health, emergency settings, and global midwifery advocacy. Neha's midwifery practice has focused on low-resource settings, reproductive health in crisis situations, and climate-affected communities. Neha was named both the BBC 100 Women's List as a climate pioneer and the Time 100 Climate List. And now I'm happy to present our 2 wonderful panel speakers. Ms. Devery is a dedicated midwife and educator with extensive experience in maternal and public health. She is currently a PhD candidate in career and technical education and holds a master's degree in midwifery education and public health, along with a bachelor's degree in midwifery. A practicing midwife and a registered nurse, Ms. Stewart serves as a lecturer at the University of West Indies School of Nursing. She is a president of the Caribbean Regional Midwives Association and a member of ICM's committee, where she contributes to advancing midwifery practice and education across the region. And we have Eunice Atsali. She is the vice president of the Midwives Association of Kenya and is a passionate and experienced midwife professional with strong academic background and over a decade of experience in clinical care, education, research, and health policy. She is currently a PhD candidate in midwifery at Stellenbosch University and a proven leader in capacity building, curriculum development, policy development. She has contributed to national healthcare policies, curricula, standards through her work with the Nursing Council and the Ministry of Health of Kenya. Welcome to all the speakers, and I'm happy to pass the floor to Anna.
Thank you so much, Igor, and warm welcome to everyone. It's such a privilege to have a great panel, but I also see that some of you from our partner organizations are here, and that's very, very appreciated. Thank you for being here with us. So we are going to talk about midwives saving lives in crisis. Being a midwife myself, we have had the development agenda for a long time, but less so in the crisis and humanitarian settings. And that's really why it's so important that we have this gathering and this webinar. The recent research are really showing a dire and heavy figure of 64% of the global maternal deaths occur in crisis and fragile settings. That's a significant number, and it is very, very serious that we start to take this dialogue on board and speak about the role of midwives and the situation that women and newborns find themselves in involuntarily when a crisis hits. We know that midwives are often there before crisis happens, but they're definitely one of the most important and often the only health professionals that are there when the crisis and the humanitarian fragile development happens. And midwives do provide life-saving care, even though the health systems have broken down. Midwives are really critical in providing those life-saving care and services for pregnant and women giving birth and to newborns. Women don't stop being pregnant or stop giving birth when a crisis happens, and she is very much in need of a midwife at that very, very moment. The next slide, please. Midwives are often the most trusted responders because they are well integrated into the community, and they are therefore uniquely positioned to reach out to the most vulnerable population when a crisis hits. They are also really able to build the trust and to deliver respectful, culturally appropriate care when that is needed. And they know of the need of the women and the families and the newborns. Midwives are also very climate resilient in action. From drought to extreme weather events, midwives adapt very rapidly, not without a cost, because it is really tough for midwives to work under these conditions. But again, they are there already, and they are not left behind and therefore it's very important that they are not left behind in the response of crisis when planning for such the structure of a response for crisis. The next one. ICM's global reach is quite broad. We are represented by 131 national associations all over the world and representing 2.1 million midwives around the world. And that means that ICM as a member organization has a huge responsibility, but also network and impact in this topic of being resilient to climate changes and to crisis. So together, this network really advances high quality midwifery care for women and newborn and families worldwide. It is really a privilege to work for midwives and our profession at global level. And it's also a very strong responsibility to make sure and to support the midwifery associations and thereby also the midwives to respond when a crisis happens. In a challenging global landscape, which we are all seeing in different shapes and forms, systems are under huge pressure. And this is why the preventative part, the preparedness part of having midwives and strengthening and supporting midwives is utterly important. And I have to just share a little anecdote from working in Bangladesh and in Laos that when a heat wave or when the heat is really extreme, midwives working under extreme heat themselves, providing care in extreme heat situation to women who are already very tired and heavy before giving birth, it is a hugely challenging situation for midwives themselves. And I don't know if you can imagine working in 40 degrees Celsius, helping a woman, being nice to a woman, respect her choices, support her in best possible way, and also the families who are around that woman. It is really, really challenging environment for midwives to work in. For the women themselves, making sure that they are dehydrated or not dehydrated, but that they are hydrated and they are supported, making sure that there is water and that sanitation is really also acknowledged, and they have clean tools and clean devices to help with. It's really, really a challenge situation for them. We have seen during 2025 an increasing pressure in health systems, which is also backsliding women's rights. The growing humanitarian and climate crisis, as we all are aware of, in different ways, but also the severe funding cuts at global health for global health and especially SRHR. I know that last week DEVEX came out with a 60% decrease of ODA, which is part of health as well, and that is a significant change in all our different ways of how we work and have operated in the past 2 decades for sure. And we know even more so that there is a global shortage of midwives. Today we have over 2 million, but we need at least 1 more million midwives. We need to take care of those we have already and make sure that they are supported and regulated and competent so that they can provide the life-saving care. But we also need 1 more million midwives to meet the needs of women in whatever setting, but specifically in humanitarian fragile settings. Despite the challenges, midwives are stepping up and they are taking a leadership in providing care and speaking up for women in challenging circumstances. So that we do have partners who do a phenomenal piece of work in terms of really ensuring that midwives are well integrated in their plannings and their programs. We do have some countries who are acknowledging the same, but we really need also to step up even stronger. So ICM, how do we support midwives in crisis? We do a lot of leadership and capacity building, and we train midwives through global leadership initiatives to which we hope or we see that they are getting stronger in responding to crisis and decision making at the time that is needed. We are more and more talking about the importance of preparedness and skills practice so that when crisis happens, that they are properly trained, properly educated, properly and competent to actually provide the care that women need at that very specific time. We are working very intensively, and that's part of our core work to support and help the midwifery associations to grow even further from where they are today. That is the sustainable investment for the future of our profession for sure. But midwifery association also needs to be at the table with the government when the preparedness for a crisis happens. So we are very much working with them to support that. And then ICM, we do a lot of global standards and advocacy work with partners, many of you on this webinar, but beyond, also to make sure that women get the maternal and newborn and sexual reproductive care that they need at the very most vulnerable time in their lives when a crisis hits. As I've said, midwives are really the first responders to climate crisis, and we are building on progress. However, the need is very, very urgent. The new numbers of 64% are really worrisome and something that we are very much focusing on, but we need to work together to strengthen that. Those midwives who are already there and already prepared to respond or even responding, they really need to be more supported as well, and really trained and equipped so that they can continue. And we do that more by focusing on specific leadership and crisis readiness, as I've said before. And the midwives associations really, really also need more support, even from where we are today, to coordinate and respond to the crisis. And of course, we are all part of a bigger system. So the systems that enable the quality women-centered care in emergencies really needs to be further developed, and that is what we can do together. So when we are working together, this allows midwives to act and to support women and newborns to survive and thrive, even though it is very, very hard times. So from that, I'm going to give back to you, Igor, and I will come back later on in the webinar. Thank you.
Thank you so much, Anna. I will pass the floor to our next speaker, Steph. Floor is yours.
Thank you, Igor, and thank you, Anna. And great to be here to the audience and partners watching. So I'm going to take a slight step back, or a step into the science from where Anna was, to look at why midwives are central to the climate response. Next slide, please. So the climate crisis is the greatest current public health challenge. We're seeing increasing global temperatures, an increase in the number of adverse weather events, and we're seeing an increase in the number of displaced communities and disrupted health systems as a result. So health systems might be disrupted by the destruction themselves. We're seeing that things such as extreme heat are being exacerbated by increasing air pollution, and that air pollution alone has a significant impact on health. All members of communities are impacted by climate crisis and disruptions to health systems, but this is most significant for women and girls, especially maternal and newborn health. And as a primarily female workforce and the main providers for maternal and newborn health, midwives have a very close connection with the impacts of climate crisis. Their lives are also displaced and their work is often disrupted. And hopefully in the next few minutes, we'll look at that in more detail. Next slide, please. Thank you. So the gendered expectations of women, that they may be cooking, cleaning, fetching water, this is exposing them to more extreme heat and climate damage than maybe other members of communities. So with extreme heat, we're seeing in pregnancy that there is dehydration that often results in urinary tract infections, which increases things like preterm birth. But we also see that women have higher blood pressure, which also contributes to babies being born early or small. And we see that there's a level of intersectionality here. So coping strategies for extreme heat, such as cooling with a fan, might be constrained by poverty. So this is not as simple as this just being a gender issue, but also is more complex, particularly in low resource settings. With air pollution, it's impacting on respiratory illnesses in newborns, but it's also, as a pollutant themselves, associated with fetal development abnormalities. For flooding and drought, we're seeing increased food insecurity and poor sanitation, which both result in worsening pregnancy outcomes. So examples might be that we see malnutrition, which also can contribute to anemia. With flooding and droughts, we see waterborne diseases such as cholera and vector-borne diseases such as malaria, and these are all associated with increased risks of preterm birth, low birth weight, and sadly sometimes stillbirth. All climate disasters for all people are associated with a deterioration of mental health, but we also see an increase in sexual and gender-based violence, particularly for women, especially when climate change results in women being displaced or needing to travel further for food or water, to work, or even to access healthcare. And these health system disruptions disrupt sexual and reproductive health in very specific ways. So we might see that access to contraception is lost, so there isn't continuity of coverage. Women are not able to access safe abortion care, antenatal care in pregnancy, or even a skilled birth attendant at birth. And we also see this has an impact on newborns when postnatal care might not be accessible, which might include breastfeeding support, particularly important when we're seeing that there's poor sanitation. Next slide, please. So in 2024, ICM, in partnership with Human Rights Watch, undertook a survey of their members to assess their perspectives on and experiences of climate change. 75% of the midwives surveyed said climate change was harming their communities. And when we asked for examples, we saw that 47% reported extreme heat and 33% reported flooding. So what we're seeing is that this disproportionate effect on maternal and newborn health is also what midwives are observing. And 95% of midwives surveyed agreed that they should be equipped and prepared to provide information to women and their families so they can be prepared for and navigate climate change. But 1 in 3 thought that their health system was unprepared. So we're seeing a gap here. Next slide, please. So why are midwives central to the response to the climate crisis? For many reasons, but particularly that they are already in the communities with established links and networks, which means they can already respond in a crisis. If a community is affected by a flood and a midwife is already there, she knows, for example, the women that are pregnant, where they can access clean water. In routine care, families often the only time they engage with the health system is during pregnancy or birth or with newborns. So midwives are really ideally placed to use these interactions to teach about preparedness for crisis. So, for example, discussing in antenatal care the need to keep cool and hydrate, but specific to that context. Midwives working in communities help reduce the carbon footprint of health services. So they cut the need for transport to distant health facilities, unlike medicalised models of care, which often depend on single-use items or frequent unnecessary interventions. Midwives use fewer single-use items, so they're supporting safe birth, but with lower carbon emissions, so contributing to a more sustainable health system. And with midwifery models of care, where a midwife is the lead provider of care in an interprofessional team that they can consult and refer with, midwives are cost effective and prevent these complications. But these systems are also scalable and adaptable in these climate adapted settings. So we're seeing that midwives can respond to the complications caused by crisis, but prevent them as well. And midwives and midwifery models of care can provide 90% of sexual, reproductive, maternal and newborn healthcare. So a community served by a health system that has a midwife in is climate resilient, because when the crisis happens, the women can receive that full amount of care either by a midwife or referred to another practitioner by a midwife. So now we probably want to hear a little bit more about what midwives are doing to respond to crisis. So I'm going to hand over to Solomon now to begin the panel discussion. Thank you, Solomon.
Okay, thank you so much. Good afternoon, maybe good morning or good evening, everyone, and welcome to the panel session, which is entitled to be voice from the frontline or from the field and midwives leading crisis. As we heard from the introduction, across the globe, climate change is no longer a distant event, which happens everywhere in every country and escalating crisis. So from hurricanes to extreme heat and prolonged drought, and this shocks usually affects the most vulnerable group of population, especially women, newborn, child, and adolescent, generally the sexual and reproductive health components. So for this reason, today we will hear two extraordinary leaders from as a panelist. So they will going to speak about their experience, real life experience on how they are combating and they are providing the midwifery service whenever there is a crisis. So we will have, as you heard from the introduction, we have two panelists, Devris from the Caribbean region, which is president of the Caribbean Midwife Association, and Eunice from Kenya, vice president for the Midwifery Associations of Kenya. So thank you so much, both the panelists, for being with us today and for sharing your real life experience with humanitarian crisis and climate affected conditions. So I will begin my question with Devris. So when the hurricane hit Jamaica in late 2025, we saw immediate disruptions of health facilities-based births. And can you walk us through how the Caribbean Midwives Association stepped into and coordinate with partners and the governments to combat these challenges? And what were the hardest midwives really faced in maintaining maternal and newborn health service during the peak of the response?
Thank you so much, Solomon. Good morning, everyone. Thank you for this opportunity too to speak about what the Caribbean Regional Midwives Association participated in. I won't say what we did, but it was a collaboration with the Jamaica Midwives Association, who are full members of ICM, and how we navigated the system. Now, for me, I want to say, luckily for me, as the president, I'm located in Jamaica. So in the immediate aftermath, I did have access to our chief nursing officer on the ground and the president of the Jamaica Midwives Association. And between the president of the local midwives association and myself, we did a little tour of those parishes. Now, on the western side of the island, there are five parishes with approximately 600,000 persons in the population and a total of 221 approximate midwives working within the maternity setting there. So when we went, we had a look at the facilities first in the five parishes. We had 3 or 4 institutions that were severely damaged by the hurricane. And as such, that also impacted on the services our midwives offered, because those were major birthing facilities. Those were hospitals. We had health centers that were flooded and not accessible, but we had displaced women too. But compacting that, imagine an island where the services are disrupted, their facilities are damaged, and we have midwives who are suffering loss. We had midwives who had nowhere to live. We had midwives who were trapped at home at work and could not go home because they had no homes to go to. So this created a barrier on the system. So what we did, I reached out to the chief nursing officer, who I asked her, how can we help? And she needed midwives from across the region to help, or retired midwives to come in. So the call was made, and we had some retired midwives, and yes, our partners within the region. I can speak to Barbados, the island of Barbados, sent some nurses and midwives to assist within the facilities, and we got the support from retired midwives to help support the system in Jamaica here. Now, the disruption in the first 2 weeks was due to no postnatal services were offered, no family planning service. Our midwives here in Jamaica is active in sexual and reproductive health, so those services could not be offered because there was just nowhere to go, nowhere to see these women. Now, prior to the hurricane, which was lucky for it's a thing that we do in Jamaica in terms of health promotion, where we advise the women who were close to delivery, you need to get close to the hospital, a hospital outside of that region where the hurricane would hit, and to get the numbers of your midwives so you can reach to them in cases of emergency. And then our midwives on the ground post hurricane too went to find their clients, which for me was important because they knew their high risk clients and they knew the ones who would not really attend clinic should something happen. So they would go out and find them. So to collaborate that way was good with the midwives on ground, with our chief nurse, and also with our partners who are on the ground, more specifically UNFPA and Direct Relief. They were on ground and they were very supportive in our activities, in engaging midwives, to support midwives on the ground and to get our women seen. And that was most important for us, that we had the link with our women and we did not lose touch with them. And in the midst of it, the Ministry of Health and Wellness played a crucial part in providing access for us to be able to participate and reach our midwives to support our women in the local community.
Thank you so much, Devris. You really highlight both the fragility and resilience of the care system you are providing in the crisis. You really reaffirm the presentation we heard from our chief executive, the director, Anna. You see how midwives are, even though the crisis happens, how midwives are still in the health system to support women and newborn. You see, that's really very important. And then the next one is to Ines, if you hear me. Ines, we are seeing a terrifying link between extreme heat and adverse birth outcomes like preterm birth and low birth weight and other adverse birth outcomes. So, what are Kenyan midwives seeing in their clinic regarding this low onset climate threat and how you are working with midwives to increase the understanding of them? Eunice?
Thank you much,
Yeah.
ICM. I don't know. Are you able to hear me?
Yeah, we hear you. Continue.
Okay, very good. Thank you so much for having me here. And on behalf of Midwives Association of Kenya, we are honored to be presenting what we've been doing in terms of educating midwives and also empowering midwives to take up the issue of their role in terms of heat and also how they can play their role in terms of policy. So what we realized is one of the things that the babies do not wait. Babies will come in whichever climate, whether it's too hot, whether it's too cold, babies will obviously come. So midwives need to be empowered in order to understand the dynamics about the heat and, of course, the dynamics of climate changes within their clinics and maternities, and also to be part of the change agents in the maternities. So as Midwives Association of Kenya, we noted one of the things is that the heat in the country, of course, in most of the maternities has really increased. And the anatomy or the architecture of maternities hasn't changed since the 1960s. So what we've been doing at stage in their counties, so that when maternities are being developed, they need to give input in terms of the architecture that is resilient to heat session by ICM, courtesy of NIHA and the team. So they firstly did a workshop for us in order to empower us to understand our role in climate change and even to understand the changes that are happening in the world. So after that, we took up upon ourselves as Midwives Association of Kenya to develop curriculum that is for Kenya, context-based. So we were able to reach more than 100 midwives in the country, teaching about climate change, their role in their maternities, in maternities. So, for example, we didn't have water in maternities, in most of the maternities.
Miss, sorry, your connection is
So
not
we
good.
would
So
have a tap, yes, running,
you can turn off your video and
but
you
then
can
we
just
didn't
speak
have
here.
water in maternities to cool the women.
Hello, Enis. Do you hear us? Yeah.
So what used to happen is you find many maternity, of course, fetal distress would occur because of the effect of the heat, and many other things would happen.
Denise?
Oh, I'm sorry.
Yeah, your connection is not good, so
Well,
you can off your video and I think it will work better. Mm.
I'm sorry.
Yeah. Mm.
We might have lost her, unfortunately.
Okay, I think I need to hand over to Nihan so that we'll see the film, and then we'll come back maybe if Denise gets a good connection. Yeah,
Or we can, Eunice will be back and then she can finish
yeah.
the panel.
Mm.
So in the interim, as Bruna mentioned, there was a flood in 2022 in Pakistan. It was a very major flood. You'd hear a little bit more about it in the snippet we're about to show you. And some of the work, so I'm a midwife, I'm based in Pakistan, and some of the work that we did as midwives in emergency response in that flood is covered through this film. And so we're just going to show you a short snippet, but Bruna can share the link if anyone would like to see the whole film. But just looking at it, just seeing the visuals and just seeing what kind of response we had is a good illustration of the kind of challenges we see on ground because of climate disasters and what a potential role of a midwife can be. So thank you, Bruna. Over to you. So Eunice is back. Do we want to maybe finish the panel before or?
Yeah, okay. If she had a good connection, I think we can proceed and finalize the panel discussion. Yeah. Denise, do you hear us?
yes,
Okay.
apologies. I don't know whether you can hear me.
Yeah, okay. If you have good
Um,
connection now, you can proceed. Okay.
apologies for
Yeah.
that. Let me just try and summarize maybe what I was
Yeah,
saying.
yeah. Summarize.
What we did, I think I just want to go through what we've been doing. So firstly, we had a training on the role of the midwife in humanitarian setting and climate change. Then after that, we took upon ourselves to create a curriculum that is context-based. Then we've been teaching midwives in 15 counties within the country, which we hope to reach all the counties in the country in order to empower them on their role in on climate change. So the changes we've already seen so far is many maternities that did not have running water, midwives have actually initiated waters to run in the maternities. Why? Because we had many cases of women with dehydration and having IV fluid, which is very expensive. And yet drinking water, safe drinking water would be adequate enough to, to help these women to get hydrated during labor. The other thing we have done is educated the midwives in order to be able to be on the table in terms of when maternities are being built, so that we have maternities that are climate resilient and that can be able to accommodate women during the heat, in terms of ensuring that ventilation is adequate and in terms of ensuring that we have some cooling system within the maternities that is actually based on solar system, that is actually, because we already have heat. So why not use that heat, convert it to cool even the environment within the maternities? There are many things that the midwives are doing, if, for example, planting trees in the clinics. And that is something we've seen across all the counties from, I think, last year, from the time we taught, we did the workshop. We've seen midwives encouraging planting of fruit trees within their facilities. And the thinking is, let us have a fruit tree, one for cooling, and two, that we can have oxygen and also food for the babies. So I think those are some of the things that midwives are doing, and they are doing many, many other things in order to help their health facilities to be climate resilient. And I wish I had a longer time, but yeah, thank you.
Yeah, thank you so much, Ines, for sharing your best experience. You see, when the crisis happens, midwives are not only the frontline healthcare provider. Rather, you try to empower midwives through training and by creating a context-based curriculum. You see, and you also become innovative in combating and in combating the crisis that happens in your country. That is really what we need. So midwives are not only a frontline healthcare provider, but they are also innovator. They are also a solution maker. So thank you so much for your experience and for sharing for us. Okay, next, Devris, I will coming back to you. So if similar hurricane were come again, what systems and infrastructure needs to be in place now to ensure that the response is proactive rather than reactive?
Thank you, Solomon, for that. For me, what we would like to see as a region is for visible midwifery leadership at a national level, and at the regional level to be close to our midwives, because with this level of leadership, they can oversee training and quality, they can guide policy and coordinate life-saving sexual and reproductive health activities, especially in emergency services. Now, with this said, through leadership, they can also integrate the minimum intervention service package, the MISP for rapid assessment, those frameworks for us to work with, and to embed it within national disaster preparedness response and recovery plans, and to use a standardized approach to guide these pathways so they're aligned with the Ministry of Health and Wellness policies. So if we had clear leadership from the national level through to the local level, I think there would have been a smoother transition. And also, it would also strengthen partnerships with our agencies that are integral to maternal and child health. So in essence, this leadership would formalize collaboration with national key policies as it relates to disaster preparedness and emergency response. And then we then as a service, as midwives, then we could look at our whole supply chain and our responsiveness in emergencies so that we can hold someone accountable at that level to say, yes, this is it. This is what we need, so that there's a clear pathway, there are no loopholes, and someone is always held accountable at this point. So that's what I'd like to see from an infrastructure point of view within our region. And more specifically, I'd love to see it start maybe in Jamaica, given what had happened in the Melissa aftermath. Thank you.
Yeah, thank you so much. That is a very good looking forward and a very brief solution. That is what we need. You see, preparing the midwife and making the midwife more responsive and designing a context-specific training like MISP and strengthening the leadership, the midwifery leadership is really very important. So that when it happens again, so that we're going to act proactively to respond for the crisis before it causes major damage. Thank you so much. So the second one is again to Ines, if you hear me. Kenya deals with a triple threat that is expressed as heat, drought, and sudden flooding, often all of the same across different countries even. So what is the biggest gap in Midwives Association of Kenya current capacity to support midwives in these diverse zones? And if you had the resource to climate proof your association response today, what would that looks like in terms of training, education, advocacy, and supply?
Thank you so much, Solomon. And indeed, Kenya, is faced with the triple threat. And one of the things that midwives need to be, at the center stage one of the things that what I'm looking at as an empowered midwife is a midwife that can sit at the table when there is a crisis and even preparation for crisis. So I'm looking at a way of empowering midwives in the country in terms of taking up leadership when it comes to climate resilient environment. And this will happen through continuous leadership training, and of course, making sure that in the policies where there is setting, like for example, setting for humanitarian crisis agenda, midwives are at the center stage. So they are part and parcel of the group that is also leading the humanitarian setting readiness and also climate change readiness in terms of crisis. The other thing is we would like all the midwives in the country to understand their role in climate change, because as much as midwives are doing so much at ensuring babies are born and mothers are resilient and families are resilient, we would like all of them to understand their role in climate change and how this can affect the population positively, in a positive way. So this will be done by, Midwives Association being at the center stage in terms of empowering the midwives across the country in terms of training. The other thing that I'm looking at as Midwives Association of Kenya is midwifery model of care. Like, for example, if we are going to have midwifery model of care taken up within this country, then this is a good avenue to showcase that a midwifery model of care can actually help in terms of within the climate resilient environment, so that midwives can be a conduit or a platform where climate change can be showcased and who can easily influence the care of women in an effective way and climate resilient environment. Thank you.
Thank you so much, Ines, for your brief explanation for my question. Yeah, that's really clear. We need to empower midwives, and in the context of crisis and humanitarian context, we need to center midwives because they are the frontline healthcare provider, and the evidence and the affected group of population. We usually see that women and pregnant women and children are usually the most affected individual when crisis happens. So putting midwives as a center and as a conduit for responding to the crisis is really very important. And thank you so much for sharing your wonderful experience. So now is my last question for both of you. So you will respond within maybe for the future reflection. So in one sentence, my question is first goes to Devris. What is one thing you want our audience to understand about why midwives are the most bankable investment for climate adaptation?
Why midwives are?
Bankable investment for climate adaptation.
For me, it is
Yeah.
important to invest in midwives for adaptation, because we are the backbone of sexual and reproductive health. And one thing I say to our governments is, please invest in midwifery education. It is essential because for our profession to grow within any setting, we need that support, we need that investment, because we are doing the work. And as such, investing in what we do so that we do what we do best through our models of care, as Eunice had highlighted, it can create a big difference in crisis settings, because we would be empowered and ready to provide this service when a crisis happens. Thanks.
Yeah. Okay. Thank you so much, Ines.
Thank you so much, Solomon. I think one of the ways I can summarize what I've been saying is prevention is better than cure. And investing in midwives, especially during crisis period, is actually investing in prevention. Midwives that are empowered to respond to the triple threat we'll actually be able to avert a lot of complications that may subsequently occur in women and newborn babies. And when we think about the rights of women and newborns, and even the midwives, accessing health in whichever climate, in whichever environment, then I think we look at this as a great investment. Thank you so much.
Okay, yeah, thank you so much, Devris and Eunice, for sharing your expertise and your lived experience as a frontline healthcare provider and by representing midwives. So what we heard from today is that midwives are not the only frontline healthcare providers. Rather, they are leading, innovating, and sustaining care under the most difficult conditions. You see, even crisis happens, midwives are the frontline healthcare provider. Not only the frontline healthcare provider, but they are also leading, innovating, and sustaining the sexual, reproductive, maternal, newborn, and adolescent healthcare services. So thank you, our audience, for joining us this webinar. So now I will forward to Niha. Thank you so much.
What happened in Pakistan is these catastrophic floods in which we saw millions of homes destroyed, people became homeless, a lot of people's land was lost. And we just saw that one of the biggest casualties of this complex emergency was pregnant people and newborns. So we saw that women were just having to give birth in tents, they gave birth, some women gave birth in the water. It really led to making the maternal and neonatal health situation much worse. I mean, we saw infections, we saw maternal deaths. The sheer amount of tragedy that had happened, I think it's something that you couldn't actually understand until you were on ground. I wanted to understand what was happening and what it was that I could do in my capacity as a midwife to support these women.
तीन फ्लड का एक्सपीरियंस 2007, 2010 और अब ये स्टार्ट हुई थी ना रेन तो हमारे ओपीडी 5700 और 64 एबारपी एबारसी मलेरिया कम 100%, मलेरिया केसेस 100%। तो ये जो हमारा जो कैंप हम लगाना चाह रहे हैं कल और परसों के दिन, वो बेसिकली प्रेग्नेंट औरतों पे ही फोकस होगा। तो फरीदाबाद बीएससी सेंटर मर्दनानी अस्पताल उत्ते अच्छे सुबह 10 बजे ठीक है ना बारन के पछे जो तो ना पे नड़े के खई वजा सही है हम माई के पेट आते आता माई आसो आप पेट से हां 4 महीना 4 महीने बस सही है आप आइएगा हां
इसके बीच में लगाते हैं गाड़ी को ना हम लोग, वो गाड़ी आगे हो गई साथ।
Unfortunately, we don't have time to play the whole thing, but I'm gonna drop the link in the chat so you can finish watching it.
Thank you, Bruna. I will now pass the floor to Neha.
Thank you, Aiko. So I want to build on a little bit on what we've heard from the associations and from Anna and Steph and see what ICM's role is in the global landscape. We've heard a little bit from Anna about what we're seeing, and I just want to go a little bit further into that. So next slide, please. So as you heard from Steph and Anna, climate change we see is increasing risk for maternal and newborn health and humanitarian crisis and fragility. This is something that climate crisis was something we'd see here and there. We are now seeing that a lot of the countries that we're working with are in a state of polycrisis. So they have humanitarian crisis, they have a climate crisis, then they have with it an influx of displaced populations. We're also seeing that the current situation in the world right now. So because of humanitarian crisis, because of war and other factors, we're also seeing a very close link between that and the climate crisis, and increase in climate-related challenges because of what's happening. As Anna mentioned, funding levels have decreased globally. We have been speaking to our associations, and we have seen that when they speak about clinics, they speak about their response work. This is something that they're feeling quite directly in terms of the funding decrease. And health systems are under strain. And there's new things that we've started seeing because of the geopolitical situation. I know that I can give an example of Pakistan. We've been speaking to our associations all over sub-Saharan Africa as well. And these countries may not directly be part of the current geopolitical situation, but everyone is feeling an increase in fuel prices, for example. And I see in my own work that when there's an increase in fuel prices, we see an increase in the second delay. So small changes globally that are affecting midwives and the maternal health situation all over the world. And through this, midwives we see remain consistent frontline providers. And a lot of times they are affected, as we heard, by climate emergencies, by climate change every day, by humanitarian situations. A lot of times they're part of displaced populations, but as long as they're situated in their communities, they continue to provide that service. Next slide, please. So the gap that we see in our work with midwives, with associations, is that the climate, health, and humanitarian agendas remain siloed. And a lot of times when we are in climate spaces, we do not hear about the role of maternal health. It's kept quite separate. And this is also something that we as midwives on ground, this is what we see as well, that even if we have interventions related to if we have a telehealth system, or we have data collection, or we have some kind of response, climate and humanitarian response is not integrated into the work. And even for data that's coming out from the ground, there is a need to understand what that nexus is and what that integration looks like. So we're seeing that these agendas remain siloed, and we're not getting people together at the same space speaking about them. SRMNH, we know, is often underrepresented in climate financing. We can look at any big climate gathering, and we'd see that SRMNH is often something that you'd see somewhere, but it's not really something that we'd see integrated or something that's part of the mainstream conversation. Similarly, we've heard from Deborah, who had the midwives in Jamaica, part of the larger Caribbean network, had a very large systematic response. But a lot of the midwives and the associations we work with, they do provide very big responses. They're really large part of the response in emergencies. You can look at even the documentary that was just shared. The work that I did with the other midwives was a large part of the response, but it's not systematically included in preparedness and response. And in adaptation planning, which means that you're not really improving the system in that way. And because there is that gap in data, in integration, in understanding the situation, there is limited frontline data and implementation models that we can use to learn from. Next slide, please. So ICM, as Anna mentioned, has a network of 131 associations. We represent more than 2 million midwives. We do set global standards and competencies for midwives and midwifery practice, which I will speak about in the shortly. And we are a trusted partner and because we work so closely with associations on ground, we do have a lot of contextual understanding about what kind of responses are happening, what the role of midwives has been, what kind of gaps midwives themselves are experiencing when they want to be part of the response framework, and what the role can be in the maternal health systems. And so ICM, in that way, we work very closely with global policymakers in the global advocacy space, but we have the ability to take that to frontline practice and knowledge because of our very large network of midwives. Next slide. So in this way, as Anna mentioned, part of what the main thing that ICM is doing with association is that we are strengthening local midwives associations as national actors. And the aim is that when we work with associations, when they become strong players, they can become part of the response framework. And what we want is that when there is an emergency, we're not calling on midwives just to come and, conduct some deliveries or hold a camp. We want them to be there at the decision-making table when there is preparedness, when someone wants to know what it is that midwives need, what communities need, what will work for women and families and babies in this situation. So, and a large part of that, where associations are the voice of midwives on ground, strengthening them gives them this role in leadership in the climate and humanitarian response space as well. For us, for ICM, knowledge equity is a really big part of our climate response. The climate space is changing so fast, and knowledge and evidence on climate is coming out every day. And the biggest thing is that until midwives and women and families and communities know what it is that we're seeing, what happens when PM 2.5 levels are high, what happens with excessive heat to your body, what happens to blood pressure as a result of increasing heat. Until they know what those connections are and what it is that their role can be, they cannot be part of the response. So a large part of what ICM is doing is working on that knowledge equity bit and integrating climate and humanitarian competencies, both in pre-service education, in-service capacity development. In 2024, when there was a update to ICM's essential competencies for midwifery practice, we integrated climate knowledge around climate change and response into those essential competencies, which means that midwives and associations can now advocate for this to be something that all midwives need to have knowledge and skills related to. ICM also supports on-ground implementation. We want to work with associations on ground where they do work on heat adaptation, provide them that support, provide them advocacy support, help them become crisis ready, help them develop climate-friendly health facilities, which, as Eunice mentioned, is something we have worked with the association in Kenya. And also when they have this knowledge, when they're doing this on ground for other associations to learn from them. We want to work with associations. ICM is doing this to generate midwife-led evidence for policy and practice. There is so much value to local knowledge and local evidence around climate change and its impacts on ground. And we want midwives to be able to harness that and use it both for their own evidence and advocacy, but also for us to learn from them. And we enable knowledge exchange, knowledge equity, and digital learning so that everyone has access to information on what's happening globally and what's happening with other associations. And then we have ongoing global and local advocacy for midwives to become part of the response and to be seen as large players in the climate change and climate preparedness space. Next slide, please. So the opportunity that we see here is that there is a growing need. As we see that climate and crisis is something that is everywhere. It's not stopping. Climate change is not stopping. And what we're seeing as a result is that climate and crisis outpacing system readiness, and health system strengthening is a big part of what needs to happen. But there is also a really big gap that remains because of how fast this change is happening. Midwives are high impact, but they're underinvested in a lot of spaces. And there is a very large opportunity to build resilient community-based systems, which are ensuring continuity of care, which are centered around the midwife-led model of care. And midwives, as we've learned today and through the work of midwives globally, is a low-carbon healthcare model. It has strong returns and impact with minimal investment. And through this work, it's possible there's so much potential to reach midwives globally, including in fragile and climate-affected settings. So thank you for that. Over to you, Aigul.
Thank you so much, Neha, and thank you to all our speakers, especially to our panelists, Eunice and Devery. And I will now pass the floor for closing and call to action to our Chief Executive. Over to you, Anna.
Thank you very much. And I can fully echo that. Thank you so much to Eunice and Devery for sharing very, very important stories from Jamaica and from Kenya, which is applicable in many other settings as well. But your voices are very, very important. So thank you for that. I'm specifically taking with me, Eunice, you said something about that if midwifery models of care as a model of care is implemented, the resilience could be stronger. And it's a very good point, because midwifery models of care is not only having midwives in the system, but they are already there following women throughout their pregnancy, birth, and postpartum. So they know very much, as it is more or less the same or a small group of midwives focusing on the women throughout that process. So I think that's a very good point that you brought up, Eunice, around having midwifery models of care well implemented into the system already from the start. I also really appreciate Devery, what you shared about the midwives themselves being hit themselves by the crisis that happens. And I think, as you have alluded to also, Neha, in your presentation, that we need to take a stronger account and support our colleagues, not only before, but definitely under, and also to find different solutions on how to support them. Many of them have lost their homes and families, members themselves. And it is really a vulnerable situation, not only for women and their newborns and their families, but definitely also so for the midwives themselves. And by all means, many other healthcare workers as well. So the whole system really, when that breaks, it affects a lot of individuals. I have to say, I love the quote that midwives are solution makers. That was a very, very positive ending to today, leading also into the call for action. Now, the crises are accelerating. We know that. And just that you mentioned the fuel crisis that we're in at the moment, that will have a negative effect on midwives providing care, on women having access to care. So we need to address this, that care for women and newborns, it cannot wait. And it was very clear from the film. I could see that for sure. So together, we really need to commit to flexible, long-term investment, and also very, very close partnership, very effective partnership with ICM to strengthen the midwives, our colleagues out there, and their midwifery associations, to enable a rapid, locally led response in climate humanitarian affected settings. So it's really being agile and quick, as we heard from Jamaica, to respond when the need is absolutely crucial. Together, I'm 100% sure that we can ensure that without care when needed the most. When life, that she's not losing her own life, or we can do that together. So to all of you, thank you much for being here with us during this webinar. To the team, thank you so, so much for your contribution, for your coordinating, leading us through this. And to our dear panelists, Eunice and Devery, thank you so very much. And with this from The Hague, we all wish you a great rest of the day or evening or week, and look very much forward to stay in touch to move this agenda strongly forward. Thank you and goodbye.